Coming to managing patients with cardiovascular diseases during the month of Ramadan, the most important step is to risk stratify these patients. And these patients can either be low to moderate risk, and such patient may be able to fast, but they have to listen to medical advice. And these are the patients with stable hypertension, with stable angina, stable non-severe heart failure with left ventricular ejection fraction more than 35%, or patients with heart failure with preserved ejection fraction, patients with implantable loop recorders, with permanent pacemakers, either single or dual chamber, patients with mild or mild to moderate valvular diseases, with supraventricular tachycardias, atrial fibrillation, non-sustained ventricular tachycardias, and mild to moderate pulmonary hypertension. So this is a category of patients who are deemed low to moderate risk as per our current understanding.